Hi everybody, it's Dr. Satey coming to you from Beverly Hills, California. Today's topic is the BBL, or Brazilian butt lift. The first question that I want to address is who needs a BBL, who is a candidate for a BBL? The second is what's the difference between a BBL and a true buttock and lateral thigh tuck or lift? And the third thing is how do you address the ptotic or more of a saggy buttock? So going with the first, a Brazilian butt lift is essentially removal of fat from one area of your body and reinsertion of that fat into the buttock and the lateral hips. Second is the area of the buttock. Fat is removed with some type of liposculpting, and then it's reinserted into the buttock and lateral hips. The key here to understand is that with the assistance of Vaser, which we went over in a different video, I can still use that fat, in fact, in a more effective manner than traditional liposculpting. The one thing that I want to caution you is using the fat from laser-assisted liposuctioning, because laser-assisted liposuctioning actually kills the fat cell. That is fat that you do not want to use for a BBL. So just keep that in mind. Moving on is the patient that needs a lateral thigh and a buttock tuck. Can you combine a BBL with a lateral thigh and buttock tuck? The short answer is yes. The patient that needs a lateral thigh and buttock tuck are patients that have ptosis, which was my third question that I first posed. It's the patient that has more of a saggy buttock, a droopy buttock, or a patient that has more of a buttock height that they want shortened. So the first thing that you want to address here is to see whether or not you actually have ptosis, or that sagginess or loose redundant skin. Because if you do, you may want to have that skin addressed if you're not trying to add too much volume. The alternative here to avoid an incision is to go a lot larger with the buttock. The way that I like to give the parallel is think of a beach ball. If a beach ball loses volume, it starts to droop a little bit. Now, you can either take out one of the pleats of a beach ball, sew it back together, and blow it back up with air, and it becomes nice and plump and tight again. Conversely, if you don't want to remove a pleat, you can just add more volume or air, in this circumstance more fat, to again get that buttock to really fill in, especially the lateral hips as well. So for my patients that don't want to have a large incision, I oftentimes will tell them we're going to go pretty big with the buttock and lateral hips to offset that incision. So it's a give and a take, and it's a beautiful balance. But again, it really comes down to what my patient's desires are. And there's no better way of telling them what they need than a consult. So when you're deciding on what you want, whether it's a fat transfer or a buttock lift or a lateral thigh tuck or some variant or combination, make sure you ask your surgeon to go over this with you. Thank you.